Before we start, before I give the introduction for this session as you're filing in, I wanted to mention, and we will try to mention it again at the end, but it's a little chaotic as we're all filtering out, so I want to make sure you're aware. The awards luncheon after this, there will be a table in the back of the ballroom with cards that designate various food allergies. If you have a food allergy, you need to pick up one of those cards because otherwise the luncheon is the same serving for all. So if you pick up a card, the wait staff will be able to identify if you need an alternate meal. So make sure you do that. Again, back of the ballroom, the cards will be there, and then the wait staff will be able to get you what you need. We are here today. My name is Missy Anthony from Ohio, and I'm a member of the Education Committee, and it's my pleasure to welcome you to Communicating Licensure and Disciplinary Actions, Best Practices Across Professions. This session will discuss practices that other professions have used to facilitate better cross-jurisdictional communication for considerations for FSBPT in enhancing information sharing. The speakers for this session are Dustin Dollar and Michelle Sigmund-Gaines. Dustin is the director of the Physician Data Center at the Federation of State Medical Boards, overseeing FSMB's data services, including docinfo.org. Michelle is the executive director of the Oregon Board of Physical Therapy and a director on FSBPT's board of directors. They have valuable information to share, and we encourage your participation. If you wish to ask a question during the Q&A portion, the members of the Education Committee will provide you with a microphone. And we ask that if you do ask a question that you begin by stating your name and jurisdiction for the record. Please abide by the ground rules in the program notebook, including limiting your questions until others have had an opportunity, so more attendees have a chance to ask questions. At the end of the session, please scan the QR code to complete your evaluation, please. And we really value your feedback. So now I turn the presentation over to Dustin and Michelle.
Hi everyone, how are you doing? Persevering with day 2 of this fabulous programming? Good. We're really glad that you're here today, and our intention is to give you some material, but our intention is to hear from you, so we expect to have time to get your feedback on what we'll be presenting. So I'm going to start us out with a sort of a grounding on kind of the scope of what we're going to focus on, and it's what we, in today's world, think of as a license lookup, a licensee lookup. In the past, it's been paper-based, or you would go to a source. So you can think of it as a source for information about licensure and disciplinary action history for licensees or professionals. And it can include different things. So we're keeping it in a very generic sense. There may be things that have to do with license or compact information, status, disciplinary actions, but it can also sometimes include additional information such as a practice location, specialization, their educational background, contact information. So there's a broad variety, and we don't want to limit it, but that's what we're talking about today. And so I have the pleasure of introducing Dustin, who's going to start us out with some pieces. Have met him just a couple of days ago, and I'm so thankful I did for his knowledge and energy. So Dustin, with that, I will turn it over to you.
Thank you, Michelle. Thank you, everyone. It's an absolute pleasure to be here on behalf of FSMB to talk to our FSBPT partners. I've been communicating licensure and disciplinary data my entire career at FSMB for the last 10 years. So certainly excited to lean into some lessons that we've learned at FSMB that will hopefully help you as you guys go down this path of your own. First thing I want to talk about is a kind of a brief overview of license lookup options. We started with making this information available to the public over 20 years ago. It really came out of sharing information with the state medical boards, which was a very manual process. So when we talk about manual inquiries, you literally had to send a letter in back then and get a response back. And that was even for our boards to get access to the database that I'm going to be talking about later today. Over time, that evolved into the state-specific databases. Our states have continued to work to provide better access to that information for their state. But as we like to say at FSMB, if you know one medical board, you know one medical board. They're all so very, very different. We have 71 boards, and for us, it's really like understanding 71 different languages as far as the factors that change how you can access information on their website, the resources that that board may have at their disposal. So that really lend itself to FSMB being able to take the lead in providing a more national database through DocInfo, which I'm going to share with you guys a little bit later. So DocInfo, in a national database standpoint, it's really driven by that increased mobility of practitioners. As Michelle's mentioned, as we talk about things like the compact, we talk about things like telemedicine and at FSMB, it becomes more and more important to have this national source of truth, this national source of verified data for the public to be able to access so that they can get that transparency that they really expect in today's world. So we're going to talk about what's out there now. I'm going to do an entire overview of our DocInfo product, but I think we could also take a look at international offerings as well. It's not just an issue in the United States. If you take a look at Canada, Australia, and the UK, they all have a little different model, but they are still trying to surface that information to the public so that they can make informed decisions about their health care. I currently serve for FSMB with IAMRA, the International Association of Medical Regulatory Authorities, specifically on their PI committee. It's the Physician Information Exchange. So now not only do you have this happening in individual countries, but this committee, our job is to start to surface this information globally. So not just in the US, not just in the United Kingdom, Canada, Australia, but to make that information not only available to regulators at a global scale, but also to the public. And so that just shows another key reason that having a centralized source of verified, trusted information for the public is becoming more and more important in today's world. Michelle?
And while Dustin's worked in the international arena, if you will, if we look at an overview of what's going on generally in the U.S., there are some different approaches. And remember, just like in the slide that Dustin had a little while ago about the evolution, if you will, about the sourcing for licensing lookup, which can go from paper to sort of an instant online access, we're not saying that it's a linear path, because you'll often still have some elements that may be in paper in some locations and that. So you'll see sort of a circular growth going through this. But in state-based, there's some variability in the ease to find things. There are 53 of our jurisdictions, and there are, I think the joke is 64 different ways that you can find the information at the state level. And there's variability in what we as jurisdictions choose to share publicly as opposed to what you may need to request in paper or in a written form. Nationally, there have been some attempts to create databases for access. We're all familiar as regulatory bodies with the MPDB. The limit there, of course, is it's not publicly accessible. And then MPI has also put together an effort where the general public can access some information, but it's limited to those that actually are issued an MPI number, which of course in our world leaves out PTAs and many practitioners that aren't in the settings where those are issued. There are aggregators, there are sites that you can go to that they tend to have links to individual states, but they're not pulling the information into a single source. They may be just a link that says, you know, Oregon or Texas or Arizona that you have to click through, and sometimes it just drops you on a main page, and then you have to navigate and try to find where that information is located. And then what I would say is sort of the innovators are trying to take aggregation to the next level, where you're actually making it more seamless for the general public that's trying to access that information by pulling it with those magic wands and APIs and other pieces of it, so that you can do a national lookup offering by the profession, and in this increasingly mobile or telehealth-based world, being able to see the full view of a single individual that may well hold 17, 18, 20 licenses. So with that, I'm going to turn it back to Dustin to give us a deep dive into their innovations.
So, history of DocInfo. No, I'm not going to go into the 20-year history of it. It was actually called Dr. Data in the beginning. And you may not believe this, but it was a paid service early on. Our organization thought 20 years ago that was a great idea. It was not a great idea. We learned that lesson rather quickly. And it really wasn't aligned with our mission of protecting the public by providing a monetary fee to access to the information. At the time, I think as an organization, having the resources, I'm sure everybody in this room understands what the limitations on resources can be at different times. But moving to a free model was the right thing to do, and all these years later now we have DocInfo. So where does it really start? With DocInfo and any type of service like this, it starts with the data. We've been very lucky at FSMB from our founding in 1912. Sharing information between state medical boards has been a core principle. All these years later, we're still doing the exact same thing. So every state medical board reports to us on a monthly basis their entire licensure file and their disciplinary information. The disciplinary information comes in the form of the board order legal documents to our team. And then my team at FSMB is responsible for that aggregation of all of that information into our master data management system. I heard yesterday in one of the sessions about the unique identifier for FSBPT. We also have one for FSMB called the FID. Without that unique identifier, without that complete data set, a service like DocInfo would not be possible. The other key element of DocInfo is that it's verified, trusted data. In the world that we live in today, it used to be trust but verify. Now it's like verify, verify, maybe verify again. The sources of information that are available online about our physicians or about practitioners in general, the public needs a trusted source that they can go to access that regulatory information and know that they can depend on that for making their healthcare decisions. So when we talk about our database, this is just a quick snapshot of what our last census looked like. It's over 1 million physicians in the MDM database. We've got some great information on workforce information that came out of that census. This is just to show you that having that database is vital for DocInfo, but it's also vital for every other service that we provide at FSMB. So having that active participation from our boards, regardless of the size, regardless of the resources, being able to identify this as a priority and provide that data is really key for us to provide the resources like DocInfo, which does highlight the hard work that our boards do day in and day out, and I'll get into that in just a moment, but also allows us to do things like provide the census, provide a disciplinary alert service, much like the session yesterday talked about alerting boards when new disciplinary actions happen. That's not possible without having that core data set. And without it, DocInfo would not be possible either. So why DocInfo? The real key for DocInfo in today's world is the difference between verified information and subjective information. I'm sure everybody in here has been on a website like HealthGrades and looked at the reviews and looked at the ratings. As we get into DocInfo, into the overview, you're going to see there's no rating, there's no ranking, there's none of that. It's just verifiable, objective information based on their license. Have they been disciplined in any way? Some identifiers around where they went to school, when did they graduate, what type of certification information do they have. It does not get into that subjective world at all, and it is important for us to explain that to patients so that they understand the difference between those two things. If you've been on HealthGrades and looked at a physician's record and they have a 3-star review, and then you read all of the reviews and you realize 90% of them are about scheduling, right? The staff, they couldn't get an appointment. So this is a different set of information, and underscoring to the public how important that is a real value of having DocInfo. So on DocInfo, what you're going to find is that sanction history, any sanction that's ever been taken against a physician. Our disciplinary information goes back to the early 1960s. We had a giant file room about the size of 3 of these rooms when I first started at FSMB. So a lesson learned was we had to digitize all that to make that information more easily available in the database. The license history, again, having complete up-to-date license history reported monthly for us, and that's a key time frame as we get further into the conversation. We landed on a 30-day refresh for our website based on when we're getting the licensure information, the way the disciplinary process works at state medical boards. It's very important for us to land on the right cadence of updating the information on the website, and 30 days is where we've landed, and that's been very good for us so far. So I've thought about doing a live demo here, but my history of live demos has not been a great one. So I would hope that everybody in the room at some point today will jump on docinfo.org, look up your physician, get a real feel for the system. The version of DocInfo that you're going to see today is the 5th version in my 10 years. So every 2 to 3 years, we're making a pretty substantial update to the system to improve the usability for users, to improve things like search, which I'm just going to talk about in just a moment, and then also about security, which is going to be a key challenge and lesson learned that I'm going to share with you in just a moment. On this first screen, you'll see as soon as you land on docinfo.org, the search is the primary point of focus on the screen. We have spent years perfecting our search. Our IT team uses a tool called Elasticsearch that really allows the user to start typing in a physician's name and to get directly to them, especially if it's a unique name. They're able to find them very quickly in the database, and that speaks to the ease of use of the system. If it's not easy to use, if you're having to come to the system with 15 different criteria, I mean, how many folks know their physician's full first name even? So knowing first name and last name as a beginning point is a lot, much less where they went to school, a grad year, or any of those other elements. So we start with name and location. That gets you there 90% of the time, unless it's a name that is very Dr. Smith, Dr. Jones, then you may have to dig a little bit deeper. But in all of the tests that I've run in searching, it's usually within the first 2 pages that I find the physician that I'm looking for. So what happens when you find your physician? This is where the magic happens. So this is the profile report that's provided for each physician. So once you've located your physician and you click on their name, this opens up. The example I have here is an individual with a ton of board action. They're a diagnostic radiologist, so of course they were licensed in every state, just about, and when they got in trouble, it just started, you talk about Liz's recidivism study, I'm sure Dr. Liu came up as part of that research that was done. So we highlight that right off the bat. The good news is that most of physicians don't have board action. It's less than 5% of all physicians that have any type of board action. But when it's there, we wanted to highlight it very clearly on the page to let the public know, hey, there's something here I need to do a deeper dive on. In addition to the disciplinary information, of course, we have the license history. So we're displaying all active licenses. Now, in our data set, we have all licenses, active, inactive, any license a physician's ever had. We chose to choose active because that tells the story for the public. If you're looking in the state of Texas and they're not actively licensed in the state of Texas, that's a problem. That's something that you're going to need to do a little bit of a deeper dive on. Specialty information, we partner with some of our sister organizations like the American Board of Medical Specialties and the AOA to pull that specialty info in. And we give them credit. We give them a link and an explanation on the site about where that information is coming from. Again, to drive that idea of being a trusted source, verified source of that information. And then medical school graduation is just another data point from a matching standpoint that is important for the public to get their hands on. So by the numbers in 2024, I don't know how many of you guys are website gurus. I was not, so I had to have my web team explain this to me a little bit. We had almost 450,000 users. That's individual folks coming to DocInfo to do a search. Of those 450,000, 926,000 sessions took place. So that means they came to the website multiple times, 2-3 times over that 2024 year period. The thing that was really interesting to me was the length of the average session was 6 minutes. So people were coming to the site and they're spending quite a bit of time. I don't even spend that much time on ESPN checking scores. Today I may because I haven't been able to stay on top of what's happening in college football, but 6 minutes is a long time. And what we found is they're coming and searching for all their physicians. So for me, I have my primary DO. I have a PA that I see sometimes. That's one other point of clarification. In our database, we have MDs, DOs, and PAs located on DocInfo. But I'm also looking up my dad's physicians, my mom's physicians, my brother. When he has an issue, I'm going to DocInfo to see. So those sessions are really important. You can see people really get engaged and are curious about what kind of history does my physician have here in the United States. So all of those sessions, all those users came out to be just under 3 million physician lookups. As you can imagine, the top states that were searched were California, Florida, Texas, Illinois. No surprise there. And then this was also not a surprise, the 4.7% of searches resulting in disciplinary action. Again, less than 5% of all physicians have any type of disciplinary action, so that is consistent with what we see in our database. Now the really important stuff, the challenges and lessons learned. The first thing goes back again to the data integration. It takes a lot of effort. I have about 12 folks in my data integration team that are working on this data every day. They're doing manual matches, break-aparts, quality checks to make sure that we do have the best, most comprehensive, verified, trusted source of this information. When you're putting this out there to the public in that way, you have to have that level of accuracy in your information, not only for the public's sake, but also for the physician's sake in our case. So we do spend a lot of time and effort to make sure that data is of the highest quality. Another interesting challenge has been clarifying the verified versus anecdotal sources. I think a lot of people come to DocInfo expecting a rating, expecting some sort of ranking system that's there. So explaining to the public, and we do that on the website, you'll see there's several areas where we talk about the importance of being licensed, the importance that our boards play in regulating medicine in the different states. And what we found is that DocInfo is actually a really great tool of highlighting the hard work that our boards do day in and day out. The same work that you guys do at your board level to protect the public and protect your physical therapists. The website allows us some opportunities to do that same thing. Another issue is responding to concerns. I would wager that everybody in the room can imagine who is most likely to reach out to FSMB with a concern about the records that were posted on DocInfo. Thinking it's just the normal doctor on the street, or do you think it's probably somebody with discipline? It's 99% is someone with discipline. Occasionally we'll have someone who's like, I don't have that license anymore. Why are you reporting that? It's still active. You need to go back to your state. They're still showing it's active and reporting it to us that way. We don't get a ton of those cases, 5 or 6 a year where a physician reaches out. It's almost always related to discipline. That shouldn't be displayed, even though it's actively displayed on our state medical board websites. And I think that's another key indicator. We, with DocInfo, try to match the data that's already available on the state medical board websites. We're just making it easier to access. We're not providing anything more or anything less. So when a physician comes to us and says, that shouldn't be displayed on your website, our first check is to look at the board that sent it to us to make sure it's still on their website. In every case, it always has been. Another real interesting challenge was the high volume media interest. With physicians, especially in today's world, it happens so fast. As soon as a physician gets found guilty of some horrific crime, the media immediately goes to DocInfo to look, has her license been taken? It happened yesterday, did you take it today? We all know as regulatory entities, it takes some time to take those actions and takes resources to do that. So our communication team in our DC office, they get weekly requests based on information on DocInfo about a physician's record, and it's always related to discipline. or if they're actively licensed in a certain area. So that's just something to be prepared for, is how would you handle that? How would you handle that discussion? What kind of information could you share with the media? And partnering with the individual boards, I think, is an important part of that, letting them know, hey, we have a request from media about a physician in your state related to this case. It's a way to really give them a heads up. And these last two, I'm going to group those together. This has been a more recent challenge and lesson learned about security of the website. A couple of years ago, our IT team noticed a spike in usage in DocInfo. As they started digging into it, they realized that it was bots. It was people scraping the website for the information, having all of that licensure data, all of that disciplinary information data. At that time, we actually had the board-ordered legal document on DocInfo, was published on the website. We have since pulled that down because of the scraping activity. So our team had to do really a pretty big lift a couple of years ago to add CAPTCHAs and bot detection and rate limits to DocInfo to protect that information. And that's our job as FSMB, as a steward of this data that's coming from our state medical boards. The state medical boards own it. But as a steward of that data, we need to be able to protect it and keep it safe. And so that took a fair amount of effort to get the website up to a point where we can protect that. It's so good to today that another reason I didn't do the live demo is I probably would have been blocked because I've been searching and looking for examples and this last week. So it does a really good job of protecting that information. So the value to patients and public is very clear. It's a free, easy to use source. We spent a lot of years making it easy to use. It's supported by verified primary data from state medical boards, and it provides the public with that confidence they need when deciding who their healthcare provider is going to be. They expect that level of transparency, and DocInfo is a way that we're able to provide that in a very easy to use, very user-friendly form that also highlights all of the other important things that state medical boards do. So I hope the key takeaways from DocInfo, other than doing a search of your own physicians, I highly recommend doing that. A lot of people think, oh, there's no way that my physician's been in trouble. I literally, I've trained my dad very well since I've been working at FSMB. Just a couple years ago, he was going to have a back surgery done, and a friend of a friend told him about this amazing surgeon in Fort Worth, Texas, that he had to go see. He was the only one you should go see. And we looked him up on DocInfo, and there was a lot of problems. We immediately looked for another surgeon very quickly. So even in my own family, there's stories of finding information that was important on the decisions we made as a family for those folks. Again, transparency, having that comprehensive coverage of all MDs, DOs, and PAs. And then, of course, at FSMB, we're very future-focused. The next version of DocInfo is really going to be tied to something you mentioned earlier, Michelle. We're working with our boards to integrate APIs and getting to a point where the real-time data is available on DocInfo instead of every 30 days. And that goes to our data guidance and data quality initiatives that we're always working on. So we are committed to that continuous improvement, continue to make it more visible, continue to make it transparent, and to continue to educate the public about the information and making a good decision when they're choosing their physician for their healthcare needs. And with that, I'm going to turn it back over to Michelle.
Thanks, Dustin. For the audience, I do want to see that that's the scariest part of this presentation is, can I get up and out of that chair and back into it that many times? So luckily, we didn't make it really memorable for you. I want to pause there after what Dustin has shared with us from FSMB's takeaway. And for those of you that are tied in with your jurisdictions, I want you to really think about, what does your state do right now? Don't worry about like the national, the international, the other practices, but are you, in whatever your role is in your jurisdiction, are you aware of what your practice is in your state? And thinking of Oregon and with just the change in cyber security and everything else, I'm pretty sure we don't do any CAPTCHAs or bots or anything else on the levels of information that we have. And that's a consideration, which brings up questions like, who does maintain your websites? Is the IT within the board? Is it general? And of course, for some of us, it's an umbrella stop. It's not. how often is the usability of that website updated? They talked about redefining it and over the last 10 years, every couple of years, to make sure that it's effective for finding the information. And then what are you as a jurisdiction choosing to post publicly, and why? And as a board staff that might be in a larger agency or as a board member, I would challenge you to ask those questions if you can't rattle all of that off. And maybe that's a presentation at one of your board meetings so that you have a solid understanding of what's being put out there, how it's being used, how effectively folks can find it, and kind of what choices you might want to make in the information that you have just in your jurisdictions. So what I want to do is build upon the foundation of all our jurisdictions and talk about member collaboration here at the federation level. And we've had some conversation about what a FSBPT public license lookup could look like. And again, it's that single location where individuals could look up which states a PT or a PTA, whether they have a license or a compact privilege, and find any associated information. And of course, verify that they have a active credential in that jurisdiction. Why are we doing this? Because of you. Because members have been discussing with that there needs to be greater public access to this information, particularly as Justin and I had mentioned before with the mobility and the change and the rapid pace in telehealth and those aspects of it. And that we can better protect the public in part through data and distribution of quality data so that they can make better informed decisions. So this might sound familiar to some of you because this has been going on for a number of years. It was a topic of discussion at the most recent Leadership Issues Forum, or LIFE. And in the afterlife of those discussions, if you will, we got some input based on that LIFE meeting. And there was some, even though there's general interest in and support for the idea in general, there have been some member concerns about how exactly this might get implemented, and concerns about reporting variations and non-participation, meaning if you create a single source, does the public know that who's participating and who's not? And there are jurisdictions, we might have different level of detail, which is why it's a good idea to know what you do in your jurisdiction. And so would there be sort of a minimum data set in honor of that would be here even though another state may provide more information at that level? Concerns about protecting the professional from misunderstandings, meaning if you aggregate the information and make it so easy to find, will the public understand? In the prior session, Karen Gordon talks about discipline is discipline is discipline, but there is a difference between sexual assault and not completing a CE on time. And so how do you make sure that the public, and frankly, that's a question that's true just within our own jurisdiction, right? And are we giving that level of detail or explanation to our searchers in our jurisdiction? And we have to answer that question as we bring it up a level. And I think the mining of the data or misinformation. And of course, we need to make sure that there's compliance with state rules about public duration. There are some states that have takedown requirements after a certain amount of time. Other jurisdictions don't. So we need to make sure that we address those kinds of concerns. Now, this is my very clunky way of saying refining the scope of the public license lookup that we're thinking about based on the feedback that you have, is what that's trying to say. That we would include only what states are publicly reporting for license status and discipline. So not any additional detail or practice location or anything at that level. And in that way, FSBPT becomes that aggregator to pull that information in. Clear demonstration of which states are currently participating so that the public knows right up that they're not going to see information from whatever jurisdictions might not be there and kind of why, and hopefully a way to go directly to get that information if it's available. That this is not primary source, that they need to go to the source, to us as the jurisdictions to get the details, and that it needs to be extensible. In the same way that they've been evolving their system for over 10 years, we don't want to design ourselves into a hole and then have to completely start over. So we may add additional information in the future. So we want to make sure that it's practical and extensible. So what I have for you is a mock-up, just to give us all sort of a visual of what it could look like. And that is, you can see we harvested some imaging from the compact thing. But this idea that you could come into sort of a map so you could have a visualization of the where you have the data and where you don't. It could even conceivably, you could still click through to a state's information directly. And you can also see here that because we currently as jurisdictions report at different intervals some information to let folks know that there may be some timing differences, even if a person has multiple licenses, that there might be that time gap. So once you go through and you've seen this information, then similar to what Dustin had described, this idea of being able to put in name and state. I do think Dustin raises a good point that sometimes we may not know the first name of a practitioner, so that might be something that whether everything is mandatory to put in or an initial or what that is. But you'll also note that there are some, this is trying to highlight the notes for consumers, trying to make sure that they understand before they even type in a name some of the limitations of the system, and that that could be more prevalent, or but that idea is there from the very beginning. And then once you put in a name, similar to what Dustin demonstrated, that you would bring up a list and you would see, so we went with a very common name, Jane, and you can see the states that they have some kind of credential, what type of credential it is, the status of the license, issue date, expiration date, and whether or not there's discipline. And this is really important in our case, the date of recency for each of the licenses. That would scroll down, and you'll see we carried over the consumer information on notes to consumer so that we have that through line of making sure in each place that they're relevant to where they're looking, there's information about that, some of the limits that might exist on that. So with that mock-up and sort of the discussion that we've had today, we have some questions to explore further with members. These are some of our questions to you, but also some questions for Dustin, if you have from his presentations. We want to know, from sitting through this or having been at Life or some of the other discussions, has this concept addressed some of the concerns? And more importantly, if not, and what else? What concerns do you have? Where else should we look? What ideas do you have based on this? Building out more detail on functional logistics, what should be included, what's the update frequency? That was something that was raised up. Is participation in this should be that limited to only states that are updating at least weekly? Or is it okay that if there's a longer time cycle, that's just communicated out? And we would need to get your input on developing the information and messaging for decision makers, right? That storytelling, the impact and the value that's come up before in your jurisdictions or more broadly. And any thoughts you might have on who else benefits beyond just general public patients on that. And then any thoughts on how this should evolve. So with that framing, not to limit you to this information, the rest of the time we have today is yours. I'll put up the obligatory QR code, but we'd like to hear your feedback on this or questions for Dustin or myself on this topic.
Maybe it's because I'm old, but, oh, sorry, it's Molly from South Carolina. I'm not sure the public would even know to go to our LLR to look up a license.
Okay.
That's a great point, and something that early on with DocInfo, the amount of traffic was not what we thought it would be. When we rolled the tool out initially, it was like, wow, this is going to be the greatest thing since sliced bread. Everybody's going to use it. But even myself coming into FSMB, prior to that, I worked in higher education with some physicians, and I never once thought of there being a bad doctor or wanting to go look up their information. Not until I got board order documents in on my desk reading some of the horrific things they did that I really understood the importance of that. So our communications team, our marketing team, has had to do a lot of work in making sure DocInfo is placed strategically to where the public finds it naturally. They do a lot of work in search engine optimization to make sure that it comes up. What you'll see with that media presence is a lot of time articles and media stories will point to DocInfo for information. And so that has taken some time to get up to the level of volume that you saw in 2024 for FSMB.
And I think another perspective on this is that, I mean, our ultimate customer really is the general public. It's public protection. And I think a similar statement could be made of how do they even know to submit a complaint to us, right? It's that public awareness of fundamentally what we do, whether it's to look up a professional or make a complaint or get background information on what they should expect as a patient. That's a bigger question that's good for us to keep in mind and keep talking about. And that applies in your jurisdictions today, right? And some of those answers are the same. When it comes to the IT, and talk to the IT folks, because there's this thing called SEO or things that you can do to embed search terms and web pages that when somebody goes to the Googles, as my nephew calls it, you'll rank higher in the search. So it's through methods like that that you can get the information out.
So Corey Wolf from Virginia. First is a question, second is a comment. For DocInfo, is the state field required for searches? Because I know that has been something that's a little bit challenging also with when we're searching compact privileges, and if you have to include a state, then it might cut off your search when you're trying to figure out if somebody has a privilege somewhere or a license somewhere.
Absolutely. So we have had to spend a ton of time on search in general. And what it really comes down to is look at your entire database and how it's structured and think about how you might search for a PT. And then you have to, when I talked about Elasticsearch in today's world, it's a really smart search. So it's an algorithm behind the scenes that can use different data points to really narrow it down to the right person. So it could be state needs to be required. Maybe it doesn't need to be required because of the compact and other issues, but that's going to be one of the key components that you have to get right is to have a really well laid out search that's easy to use with the data elements that the public's going to have at hand and that matches up with the database that you guys have created.
Yeah, and just, well, actually two comments, because one of the things that I thought of too is that some states have temporary authorization of practice, so you may not necessarily be looking for a license in state A, but they may have a state license in state B that allows them to practice under state law. So that was something I was thinking of. And second comment is I really like on the DocInfo website, there's information about how to file a complaint and then directing to the individual state websites. I thought that was a nice feature in terms of the consumer information that was provided as well.
Absolutely. That was one thing in my demo that I didn't explain very well, but we do try to, after that initial session, if there's additional information that the public wants, to send them back to the board, especially when it comes to disciplinary information. I know Michelle mentioned a concern of how's the public going to understand this? Are they going to understand what this disciplinary language means? So we provide, for a long time we had, at FSMB, we have our own proprietary action and basis codes like MPDB does. And we provided both the action and the basis, and that did cause confusion. They're like, well, what does that basis code mean? What does that mean? So now we've pulled that back to just providing the action code. Most people can understand they were revoked, they were suspended, they were put on probation. And then for additional information, here's the link to the board's website. So it does give us that opportunity to really highlight the work that the board does and get those public members back to their state website.
Ellen Rober, North Carolina. I have a question for Dustin and then for Michelle. So Dustin, my question for you is, do you all sell lists of any type to employers or credentialers?
We do. We have data files for specific entities, so we don't sell it to everyone. We make it available in the credentialing industry. And we also have some government entities, typically the Advanced Provider Screening Tool for CMS, the team that contracts with HRSA to provide that service. They do purchase a data file from us, in order to do that work. But I will say there are a lot of lines in the sand that have been drawn about who we can sell that data to when it makes sense. And it always, always has to be in the realm of protecting the public. So for credentialist organizations, credentialist software companies using that data to help credential individuals, that's the biggest part of that business for us.
And there's no personal data other than their name and their license?
Correct. All publicly available information, name, MPI number, license number, disciplinary information. Our location data is pared down to just city, state, zip. We don't provide any addresses, no emails, no phone numbers, no type of PII information. Med school and grad year are included from a matching standpoint so that the data is a little bit more usable. But we're very, very careful about who we share that data with.
And then my comment or question, I guess, and maybe just a thought. So one of our biggest challenges in North Carolina is getting disciplinary information on applicants who, or, following our military privilege, that's what we call what we issue for the federal law, in order to comply with the federal law about military spouse. But we have problems getting information when that person is not, we don't have access to the ELDD information because that person has never applied as a traditional licensee in North Carolina. What I wouldn't want to see happen, though, is the only way we can access is then to go out and do the same thing the public does, because it is very helpful to get the alerts when something happens immediately from the FSBPT that something's happened in another jurisdiction. Because sometimes it's super important and it is an immediate public safety issue. It's not just they missed a CE. So have y'all talked about that, thought about that when you're thinking about this public licensee? I think the public licensee lookup is awesome, but I wouldn't want it to come at the expense of what we have currently and how easily the states get the information when it is time to get it.
And if go ahead. I'll just get real quick from an FSMB standpoint, it's always boards first. So the Physician Data Center, we have our entire query system service built directly for our boards that is completely different than DocInfo. It has more information. It's immediate access to the data versus the 30-day time frame. Documentation, artifacts, all of that information provided for that exact reason. The boards need access to it quickly, faster than anyone else, and to have all that additional detail that we wouldn't be able to provide to the public. So that was our core focus first. That was built way before DocInfo came along, and that's always our focus. That, and then we're able, based on that work, to provide something like DocInfo.
And I would just say that no, this is not intended to replace the jurisdictional interface or anything else. This is a and, okay? And I think there's a comment in back and then in front.
Yes, Missy from Ohio, and I'm going to come at this with the bias that Ohio has a shared licensing system across professions. And so I just was wondering if you've ever given thought to working with other disciplines to house the data similarly, using what you've already worked hard and all the lessons learned here, because to me that's an obvious opportunity for the public.
That's a great question. I know those conversations have happened over the years. I say there hasn't been a lot of movement because of the difference in some of the differences highlighted here today in the way our system is tailored to the physicians and the amount of information we have versus the other systems. But something that we're always open to working with every profession. So absolutely something we could look at.
We have about 30 seconds left, so I want to get to your last question, at least to get it asked, even if we have to answer it offline.
It's kind of quick. Lori Wallace, I'm a PT board member from Georgia. My question is the opposite. So I know that everybody is clearly innocent until proven guilty, and we don't want to post things that haven't been fully adjudicated yet. But I wonder if this may give people a false sense of security if they go and they look at the site and they see no sanctions, but the doctor may have 5 pending sanctions or 5 investigations. And is there anything on the site or any thought to say this only includes things that have been fully adjudicated or something to that extent?
That is what we put on the site. That these are full, final public actions that have been taken. And again, that goes back to Something that we probably can improve on is educating that this isn't the only source of information you should rely on. It's a great source for that objective information, but also looking at that subjective information, sometimes where there's smoke, there is fire, and using all of that data available to you to make a healthcare choice. But this being a very important part of that, but maybe not the only one.
Thank you for all the questions and for your attention. I do want to say that please, if you have any other thoughts or ideas, come up to Dustin or myself after you've had the traditional FSBPT light lunch, and we're happy to talk to you further. Thank you.
Please make sure, I had an addendum to what I just got a text to what I announced earlier. You need to pick up a meal card whether you have restrictions or not. But if you don't have dietary restrictions, you pick up one called Surf and Turf. There you go. There's your QR code.
The card says servant, yes. No, wait here.